Hi, my name is Kevin Pho. I'm an internal medicine physician, and I blog at KevinMD.com.
And a lot of people would consider you one of the most prominent doctor bloggers out there. And one of the things you talked about here at Blog World Expo was why you blog. Why do you blog?
Well, the biggest reason why I blog is to give a physician perspective on current medical issues. See a lot of patients, they get studies from newspapers and television, and it's done so without any physician contact. So I have patients coming to my office and saying, Dr. Pho, what does this mean? So a blog is a great way to communicate with patients and update them dynamically, pretty much on an instantaneous basis, what I think about things. So it's grown over the past few years, not just talking about studies and drugs and whatnot, but now with healthcare reform, it's I certainly have a lot of opinions about that. So it's an easy way where I can share that opinion and maybe influence some people.
And you've had a lot of success with your blog. I mean, talk a little bit about some of the results. You get interviewed in lots of places. You get asked to comment on different things.
Yeah, well, it's certainly unfortunate. When I started my blog, I never thought that people would be interested in what I had to say. But now, yes, because I have that readership and it has the attention of mainstream media, I have the opportunity to write for national publications. Reporters call me to ask my opinion on various issues, especially with healthcare reform. So it's very gratifying, and certainly I'm humbled by it. And I think that it's a great way to expand my platform to speak to people who don't normally read blogs.
And I think a lot of people would agree that the rise of doctors blogging hasn't really kind of taken off. When you talk to some of your colleagues about blogging and why you do it, what sort of things do they ask you? Do they consider blogging? Is it sort of you're the maverick out there, or are a lot of people that sort of thinking about doing it?
So I think there are a couple of barriers for doctors that prevent doctors to blog. First off, in general, the medical profession is always 2 to 3 years behind when it comes to technology. You have doctors having trouble even emailing their patients. How can you expect them to blog? I think the second thing is also that it's a matter of time. Doctors are busy people. Primary care doctors, of which I'm one, we see 25 to 30 patients a day. We have families to raise at home. The last thing that we want to do is blog and participate on Facebook and Twitter. So I think that time is the most significant barrier, and once we could get past that, if doctors can find a way and realize the value of it, I think that would be the key to further augmenting its growth.
So last question. The panel today was all about the future of the medical blogosphere, the state of it today and in the future. What do you think the future is going to be for medical bloggers?
So I think that blogging is going to only grow, and I think it's going to consolidate with other forms of social media like Facebook and Twitter. I think there are more barriers to start a blog rather than being on Twitter. So I think that rather than compartmentalizing it into blogs and Twitter and Facebook, I think doctors just need to have a social media presence. We need to be searchable on Google, and the easiest way to do that is to participate with these social media platforms. Blogging is one, but I think that you're going to find more and more doctors also engage in Facebook and Twitter.
Thanks very much.
All right, good. Thank you.